We have an update from the Polk County Public Health Director, Sarah. She just walked in. Thank you for coming.
Hello. Thank you for inviting me. My name is Sarah Reese. I am the Polk County Public Health Director, and I was asked to come and give a situational awareness briefing, if you will, to let you know what's going on in our world. So, and certainly I can answer any questions that you might have. So just to back up a bit, the COVID, what's the word I'm looking for? Excuse me. The COVID situation is sprinting. We're on a mad dash right now, and it's been changing a lot over the last several weeks. So when COVID first appeared, our response very much mimicked that of what we would see with a response to influenza. So we were really talking about those precautionary measures that everyone could do. Wash your hands, stay home if you're sick, cover your cough, etc. So those precautions are still really important. And what we've had to do is pivot a bit and take another strategy on. And so that strategy in the public health world is community mitigation strategies. And the reason that we're pivoting that way is because we want to be really intentional to both reduce the number of cases and also to slow down that spread. And the reason that we want to do that is because for several reasons. One, because it's a new virus, so we don't have immunity to that virus. There's also not a vaccine or treatment that's readily available. The other reason that we want to do that, which is really important, is because our healthcare systems are or will become very overwhelmed quickly. Most of our healthcare systems are critical access hospitals or affiliated clinics, and they only have so many beds. I've said earlier today, a hospital bed right now is like a gold platter. And so we only have so many beds, and there's only so many staff to work to provide personnel for those beds. And so it's really important that we slow that spread of disease down, and we also spread it out. That's very important. The other thing that people don't often think about that's really on my mind is life is still happening around us, and so people are still having strokes, people are still having heart attacks, people are still falling and breaking their leg, and they need to be able to access healthcare facilities as well. And so it's really important that we do all that we can to minimize that potential of spread. And so the community mitigation strategies have been very intentional. And so if you were listening on Friday night, Commissioner Malcolm and the governor announced the community mitigation strategies in a variety of ways. The most common thing being social distancing, really keeping that 6 feet apart away from one another, which can kind of feel a little bit awkward, and you're all now like going like this. But the 6 feet apart is really important. And then also to take precautions, protective equipment, use that if it's needed, if you have to respond to something. And so those community mitigation strategies are really important for those people that are currently well, and it's also important for people who are sick right now with other things, and it's also important for people that are at higher risk. So right now, the individuals that are considered high risk, the Minnesota Department categorizes those as people who are 70 and older. As a caveat, the president said 65 and older, so you pick your number. So 70 and older is the number I'm currently using. And then there's 3 high-risk factors: heart disease, lung disease, and diabetes. Then there is a variety of other underlying medical conditions that would put you at an increased risk, but you don't fall into that high-risk category. And so, again, we really want to protect people's health and protect that spread of illness. We know from the preliminary data that the spread of disease, so how fast it's spreading, looks like approximately similar to influenza right now, but that's only based on baseline data. And as we learn more, that's changing. We call that an R none value if you're a math and science person. And so we're really watching that rate at which it spreads. And so when we look at the data, we're looking for cases. There are cases that are really black and white from an epidemiological perspective. So those would be cases where they've been around someone exposed or they've been on a ship where there's been an exposure. But unfortunately in Minnesota, we have seen what's called community transmission. So that means when we go out and do a contact investigation, which is simply an interview, we're talking with the person who's become sick and has that diagnosis, they cannot pinpoint who they were around that was sick or how they got it, which tells us that there's more cases across Minnesota, and hence why our level of concern raises. And so all the more important that we implemented these community mitigation strategies on Friday. Then let's fast forward to Sunday, where the governor rolled out the school closure plan. I want to be really clear that the school closure plan is not related to the public health response in terms of the guidance related to epidemiology. So the CDC has very concrete guidance about the criteria for recommending school closure based on epidemiological data. That is not where we're at yet. And so the school closure was related to having a plan in place in case we did see community spread and we needed to have alternative learning options, because right now the state as a whole doesn't have that infrastructure to have distance learning for all students across Minnesota. And so this is an effort to gear up, if you will, and we need all hands on deck. Then fast forward to, what day are we on? Yesterday. All the days are running together. So then fast forward to yesterday, and I'm sure you saw the announcement of the 2 executive orders related to businesses and other recreational areas. And so that was the governor's decision based on a variety of different things as well. And so there are different mitigation strategies that are being used based on what we're seeing in other states. Our department has been very engaged with the Centers for Disease Control and Prevention. I'm talking to them frequently. We are learning from what's happening on the East Coast. Well, first we were learning what's happening on the West Coast. Now we're really learning from what's happening on the East Coast, and all the more reason that the governor is being very proactive in his community mitigation strategies, because we really don't want to get to the point that we're taxing our health system in a way that we're not prepared to do that. The public's health and safety is of utmost importance, and all day, every day, no matter how many strategies we talk about, I always go back to we need to wash our hands, we need to stay home if we're sick, use hand sanitizer, cover our cough, and it feels like I'm saying it over and over again, but it's super important. It's something that each of us as individuals can do and be part of that solution. Lastly, we are, just to kind of talk about like the what are we doing. So we are doing a lot of surveillance and monitoring. We're on a lot of calls, making sure people are getting the appropriate information. I see ourselves as like, if you think of a bicycle, sort of we're this hub of this wheel, and we're making sure that people are getting the most up-to-date information, and we're also troubleshooting them. This is my situation, this is my situation, this is my business's situation. My grandma lives in East Grand Forks and I live in Idaho, and this is my situation and what should she do. We've done a lot of information brokering around what should people do, how should they react. There's a lot of social anxiety, and people respond in lots of different ways when they have those extra social stressors. And so we're doing coordination with the mental health centers and with primary care providers to have systems in place for that. We're working with law enforcement, with Chief Headland, with emergency managers across the county. And we're also working on our own internal plans, because as part of the responsibility, if someone is diagnosed, if someone is a positive case in Polk County, there's that contact investigation that I referred to earlier. And part of that then means they would go into isolation, and potentially others would be quarantined. And so I just want to quickly define that for you. The media and the public in general uses those two terms a lot, but they mean two very distinct things. So if someone says to you isolation and quarantine, please ask them what they're actually meaning, because sometimes we use one word but mean another thing. So isolation, if someone is on isolation, that means that they're sick, they have symptoms, and they've either been diagnosed or they have been tested and they're waiting on a diagnosis. So these would be people who are currently sick, and they would be at home on isolation so that we are not spreading the disease to others. Okay? Isolation. So then contrasting, quarantine would be for individuals who have been around somebody who's been exposed to COVID, somebody who is currently well, but has been exposed to somebody who's been sick. So those are two different things. You will also hear people who are on quarantine, and some people are like, I'm on quarantine and I can't leave my house and I can't go to work and I can't do XYZ. There's a long list of things. There's other people that will tell you, I'm on quarantine and I just have to monitor my symptoms for the next 14 days. I have to, am I sick? Am I not feeling well? And so there's different types of quarantine based on people's risk. And so that's important to know as well, because different things mean different things for different people based on their situation. So from that isolation and quarantine investigation that MDH would be conducting with someone who has a positive case, so someone is then going to go into isolation, they say to that person, so if you were the person with the positive case and I'm MDH and I'm coming to interview you, okay, I'm asking you a series of questions. Where have you been with? Who have you been in close contact with? Who have you been in a little bit of contact with? Like, how far can you remember? Where, have you traveled? Have you had other illnesses? And so there's a variety of questions that are asked. And then there are contacts made out to those other people. So that's how it works. As part of that plan, there's also what's called essential services. So essential services would be like, I'm in isolation, so I'm sick, but I don't know anyone in the community. I'm not well connected. I may be new to the community, or I just am not well connected, and I need help getting food. I need help figuring out how, I don't have the internet. How do I figure out food if I'm on isolation? If I can't leave my house and I don't have food for the next 2 weeks, how am I going to figure that out? Or the next week, or whatever their situation is. And so essential services is a role that local public health plays in us connecting them if they need access to food, medications, and there's a whole laundry list of things that we're responsible. So we will be providing that service if that is needed. Of course, we want people to utilize their resources, to have their friends and family help them. So we're trying to connect people to resources that they have, but ultimately we're responsible for that if they should need that. And so we are just learning new things every day. Things are always changing. The cases have been a bit predictable in terms of from the ratio of spreading. We predicted that we'd be seeing more cases now, so that's following the curve that we anticipated. People have asked how long this is going to be. I've said, I'm a runner, so I've said this is a marathon. We're on mile 2. We're not on mile 16 or 23. So keeping it in perspective, we're doing the best that we can with the resources that we have. I'm exceptionally proud of our collaborations and our partnerships across Polk County, including East Grand Forks, working with the school district, working with law enforcement, emergency management. We've worked with business leaders who have been making plans for the what ifs. And so really proud of all of the partnerships. And if I can answer any questions for you now or in the coming days, you can feel free to reach out to me or call me, email me, or whatever you need. I'm certainly willing to help you or any of your constituents as well.
If an individual has a question, who do they contact? A phone number you can give them?
Yes, they can contact our office, and I can get the phone number to her. It's our Crookston office is where we're actually fielding all of those calls. We are in incident command right now, so we do have a communications person that's taking the "what about me" questions, whether it's a business, like, what should I do in my business plan? Or I'm worried about, my mother, my kid, my whomever. And so that number is 281-3385. And if you need that, I can repeat that later too as well. Thank you for asking.
Anybody have any questions? Mr. Elms?
If there's no cure or whatever for this, if you've contacted us and have this disease, what do you do? I mean, or you just sweat it out, or?
So 80% of people if you were diagnosed with COVID, for example, 80% of people are going to have mild symptoms. So then people say, well, what do you mean by mild symptoms? So mild symptoms is like worse than a cold. Like, you're clearly not going to feel well. You're not going to be wanting to be out and about. Some people have shared that they have also come down with things like pneumonia, also kind of in combo with that. So 80% have what we would call the mild symptoms. You don't feel well. Then the other 20% are severe cases. They're hospitalized, they need ventilators, they need all of the things we can provide them. There's no vaccine and there's no treatment, so we're treating the symptoms. We're helping people breathe better. We're helping people calm down. Sometimes people are experiencing nausea and vomiting, so we're giving meds for nausea and vomiting. That would be things that could happen in the hospital. And then there is that small percentage or growing percentage of people that unfortunately are dying, and that's what we don't want to have any deaths. We don't want to have any sickness. And so all the more reason for the strategies that we're implementing now. And honestly, I was just talking with the Polk County emergency manager, and I said, this weekend I pulled out my pandemic plan because it's supposed to be like the holy grail of what we go to. And in a pandemic plan, you're trying to get a medication to people as quickly as you can. I'm like, I pretty much need to throw that pandemic plan in the trash and start over, because it is a very different thing right now where we're trying to keep people away from one another. That's a very different philosophy. And people often will say, like, I don't mind not being by people, that's fine. But when you're not by people for 14 days, that's a long time to not be in any social situation. And so that it is a big challenge, but we have great teamwork and we're getting after it together. So,
Mr. Demers.
Thank you, Mr. President. Thank you for coming and all the work that you are doing and going to do, I'm sure.
You're welcome.
If someone suspects themselves or a family member to be at risk, I guess, of having the virus, do you suggest going to a healthcare facility, calling ahead, or having someone come out? Or I don't know what the process is.
Yes, thank you for asking. So interestingly enough, that's the reason I was a few minutes late, is the guidelines is like literally changing as we speak. And so I was being updated on that. So what we really want people to do is, if they're not feeling well, to call their primary care provider, to call before they go in. The criteria for testing is being limited. And it's being limited for a variety of reasons. One, because there's only so many test kits available right now. And so they just literally this afternoon are narrowing that criteria for high priority cases to be tested. And so those recommendations are constantly changing. But what I would say is, if people are sick and have, the fever, nausea, vomiting, coughing, etc., those symptoms, the acute respiratory illness symptoms, for them to call their medical provider. Each health system has got a few different nuances, so I don't want to speak to the specifics of anyone, but that would be what I would recommend. The other thing relative to people's individual situation of where to go for information, or if people are like, do I fit this category? Is this me? Where can I get more information? I really want to make it clear that people need to go to reputable sources, because I've gotten several calls where they've gone to national TV networks and gotten all their information from there. And unfortunately, that's not our reality in Minnesota. And so I really want to point people, yourselves included, to utilize the Minnesota Department of Health or the Center for Disease Control and Prevention websites. And I will also say, if you as a business person or whatever your background is, if you looked at a resource last week, you should go find that resource again, because the guidance is changing ever so quickly, and it's also changing in its location. So as an example, I had someone call me yesterday and they said, I was in this resource guide, this interim guidance, and I put it in my favorites and now it's not there. Where did it go? And so there's the plethora of information is a little bit overwhelming to people. And so if people are looking for a guidance document, feel free to call us instead of spending hours looking for it, because it's public health terminology that's being used and it's not necessarily written in plain language. And so if people do have questions finding a document that may help their business do planning or their whatever, we can certainly troubleshoot that with them.
Thank you. Do we also, we talk about hand washing and distance and not touching your face and things, which suggest a contact transmission. Do we also have any evidence whether there's an airborne transmission factor or not? Or?
So when it first rolled out, it was airborne precautions, which is very precise. And as of Friday at 10 a.m., specifically at 10 a.m., the guidelines changed to droplet precautions, which are still significant, but much different. Droplet would be very different than an airborne precaution. So yes, they did change on Friday. Could they change again? Certainly. But as of Friday at 10 o'clock, droplet precautions. Now, if people still choose to use airborne precautions, that's their choice. What I will say about that is if you're implementing airborne precautions but don't have a necessary reason to do that, we also only have a limited amount of PPE, that personal protective equipment. And so there are also guidance documents out there right now that are saying we need to stretch out our N95 masks. We need to stretch out our surgical masks, because they're not just like falling out of the sky, and they're not readily available. And the ones that are readily available are very, very expensive. And so that's really important to use it when we need it for its intended purpose of having it on someone that's sick.
Thank you. That's all I have. Thank you.
I know one of the reasons to call in is if you walked up to the receptionist and began to speak and tested positive, that receptionist might have to be quarantined. Now, if you walk into the reception area to a room full of people at close proximity, they may have to be quarantined. So by calling ahead, the healthcare provider would be dressed in appropriate attire, would probably meet you and take you straight to the place where they intend to do the testing. So the goal is to, again, minimize the exposure even inside that facility.
Correct.
They're going to have to mop up every single inch of where you were and disinfect. And the number of people exposed to it should be at zero, and the healthcare provider should be protected with the proper gear.
Correct. Yes, thank you. The other thing that I will mention, because it was mentioned yesterday and I had another city reach out and ask me about it, and that is related to public buildings. So the guidance that was given last night was that the Minnesota Department of Health recommends that public buildings remain open as long as they can maintain social distancing of at least 6 feet between people. And that's the guidance. You can do what you wish, but that is the guidance that was given. So not everybody has seen all of those pieces of guidance. So just wanted to clarify if that's going to be part of your conversation for the city today or in the coming days.
What Altru is recommending is that you call your health care provider, talk to them, they'll walk you through your steps that they want you to take. Mm-hmm. I believe they do have a drive-through at the hospital, at the emergency room, but you should call first.
Absolutely.
And have them tell you what you should do.
Correct. We call that curbside screening or testing. And so that's excellent advice. Call first. They'll direct you where to go. If a review's your provider or Sanford or wherever, just to check in with them. And they will direct people where to go. And we've had individuals that don't have a healthcare home, if you will. They don't have an identified doctor or medical provider. And so we've helped navigate, like, where's the closest medical provider to you that could help you in that need.
Anybody else have anything? I do appreciate you coming in and
Yes.
kind of going through all this. It's
You're
good
welcome.
information to have, and
Welcome.
people that are watching online can appreciate that too. So
You're welcome. And if anyone has follow-up questions later or things I could ask to you, feel free to give me a call.
thank you so much.
Thank you.
Okay, move on to.